what approaches can mitigate the abuse of AI for less work on a therapist's part?
I try to understand the question. They're still responsible for their notes. And so they don't get to decide to not have a note written for their visit. They're still responsible for whatever's been created. And if they can do it in a more efficient way, God bless them. But whatever gets produced, whatever they click the sign up on, is their responsibility. And I think part of being a professional is taking the ownership for what's in your domain. And the visit, the encounter, and the note, even with the support of AI, is still irresponsible. If the AI says something inappropriate in the note, they are still responsible. There have been examples in which people have gotten into trouble. I mentioned the example of references not being there. I actually did some work where I found a few references for something I was working on were totally made up when I tried to follow up on it. There's an interesting case of a lawyer who submitted a legal brief and had fake cases in there. He never bothered to check. And he's probably, I didn't hear it looked like he was going to get disbarred for it. So those young professionals have to recognize that the AI as a tool should help make their life easier. It's their responsibility when they sign off on it. They're not just saying, yes, this is a note. They're saying, yes, this is a note. And I'm putting my name behind exactly what it says.